Scenario: John recently adopted a new puppy and is now having trouble breathing. He comes to the local clinic to find out what is wrong with him. The doctor tells John that he has asthma and is likely allergic to his puppy.
Asthma is a complex, chronic airway disorder. It affects the bronchi and bronchioles in the lungs and causes inflammation and hypersensitivity in the tissues. This results in airway obstruction requiring treatment.
There are two types of asthma, intrinsic and extrinsic. Intrinsic asthma is triggered by internal factors like exercise and smoking. Extrinsic asthma is triggered by things external to the body, such as allergens like pet dander, dust mites, pollen, and food allergens. We will be focusing on extrinsic asthma.
Normal physiology. When air is inhaled, it passes from the nose or mouth into the trachea. It then passes through the bronchi, which branch into bronchioles, and ends in the alveoli. In the alveoli, the oxygen and carbon dioxide gas exchange takes place, and carbon dioxide is exhaled. This maintains homeostasis through the acid-base balance of the body. Pathophysiology. When an asthmatic person inhales an allergen, an immune response starts to occur. Dendritic cells found in epithelial tissue lining the respiratory tract respond and display the foreign antigen to the helper T2 cells. The response releases the protein interleukin-4. Interleukin-4 stimulates the production of B cells, producing antibodies called IgE. The IgE antibodies are then picked up by the mast cells and embedded in their cell membrane. On the next exposure to that allergen, the antigen attaches to the IgE in the pre-sensitized mast cell. The response results in degranulation and the release of chemicals like interleukin-5, histamine, tissue necrosis factor, interleukin-1, and prostaglandins. Histamine causes the bands of smooth muscle surrounding the bronchi and bronchioles to contract, constricting the airway. At the same time, blood vessels dilate and become leaky, causing edema or swelling of the bronchioles. Goblet cells in the epithelial tissue are also stimulated to produce mucus. Interleukin-5 stimulates the movement of eosinophils to the area, causing damage to the tissue. This causes the symptoms of coughing, chest tightness, and wheezing because the lungs are trying to expel the mucus and force oxygen through the constricted airway. Homeostasis is disrupted because respiration helps control the acid-base balance of the body. When the bronchioles are constricted, carbon dioxide becomes trapped in the alveoli, causing hyperexpansion of the lungs and respiratory acidosis.
Treatment. There are two types of treatment for asthma. Rescue drugs are short-acting, quick relief from symptoms because they dilate the bronchioles. These drugs include beta-2 agonists and oral corticosteroids. Long-term control agents are used to prevent asthma attacks and control chronic symptoms. These drugs include inhaled corticosteroids and long-acting beta agonists. Risk factors for asthma. There's a strong genetic link for developing asthma. The proteins affected are interleukin 4, 5, and 13, which influence antibody production. Environmental risk factors include allergens like pet dander, dust, and air pollution. So in summary, asthma is a chronic inflammatory airway disorder where triggers like allergens, offensive smells such as perfume, and infection provoke inflammation and airway obstruction. Episodes of inflammation are reversible at first through treatment or spontaneously. Over time and through repeated exposure to triggers, the inflammatory and immune response can lead to long-term, permanent damage to the tissues and respiratory acidosis.
Homeostasis is affected because the acid-base balance is disrupted when the lungs cannot expel enough carbon dioxide. This lowers the blood pH, known as respiratory acidosis. In asthma, the main proteins involved are interleukins 1, 4, 5, and 13. Histamine also acts as a protein.
Cell membrane. IgE proteins are embedded in pre-sensitized mast cells membrane. John learned what is happening inside his lungs and why he is having troubles breathing. He now knows that he is allergic to his puppy's dander, which caused his asthmatic flare. The doctor prescribed John both short and long-term medications.
Created using Powtoon.